Good evening. I'm Maika Jigido and I will be demonstrating on what is the importance of mechanical ventilation, how it is be used or inserted, and how to maintain mechanical ventilation to our patients. So first is mechanical ventilation is um, administered to our patients who has a very needed to have a very high oxygen, and it is usually given to our patients for them to be saved because some of them are very difficult in having oxygen in their body. So the we first that you're going to do is introduce yourself to the patient, explain to the patient what are you going to do, um, and why is it necessary, provide privacy, hand washing, and then explain to the patient how he or she can help you to the procedure. After that is assemble the materials. So the hospital has ventilator, or assuming that this is a ventilator. So this ventilator gives the oxygen to the patient. It is usually at the bedside of the patient, and it gives oxygen by inserting tubing, or the tube that is inserted to the patient's mouth is called intubator. So this is the ventilator, and assuming that uh, this is uh, intubator tube. So it will be inserted to our patient's mouth down to his or her throat, and then it will be the secretions that's coming out will be sanctioned by the assistant nurse. So this at this end will go to the mechanical ventilator, and the other end is will be inserted to our patient's mouth down to the throat, so that the patient's and the oxygen will go through um, directly to the patient's lungs. So why is it needed for the patients to have to undergo mechanical ventilation or intubated? So these patients are usually has pneumonia, has post surgery, severe illness, and blocked airway. Usually, the patients that we have that is really needed to be intubated are the patients who have blocked airway, or there is no sufficient oxygen that is coming from their lungs, and that will make them difficult to breathe. So yeah. For us nurses, we have so many things that we need to do when our patients are intubated or um, undergoing mechanical ventilation. We need to assist the client's face always, and if the tube is um, already shoot into the client's throat properly, and then we need to sanction if there is any secretions here, because most of our patients that is um, intubated have secretions mostly in the mouth and coming out. So and then after that is monitor vital signs, um, monitor any skin integrity, if there is any lesions in her face, and then after that is instruct the family members to cheer the family member that is lying and intubated, because it is a very big help for the patients to be cheered up and motivated, because being intubated isn't normal, isn't good, and our patients can unable to eat, swallow, or even speak. So it is very helpful for them to hear some motivation, to hear some um, good messages from their family members, and then support them through the journey. And then that's all for this administering mechanical ventilation. Thank you.